Public health experts say New Jersey's high vaccination rate has helped stave off caseload surges like we've been seeing in other parts of the country. But Dr. Perry Halkitis, dean of the Rutgers University School of Public Health, is concerned the start of the school year may change that. Dr. Halkitis, since the start of the summer, we've seen caseloads of COVID-19 surge. We've somewhat maybe hit a plateau in New Jersey, at least according to our statistics. Does that kind of jive with what you understand to be the situation on the ground right now?
I mean, what we've seen, Brianna, is over the course of the last month and a half, like a huge uprise in certain parts of the country that are not well vaccinated. So Alabama, Mississippi, Florida. In New Jersey, which is better in terms of its vaccinations, we have not seen this spike. Now, does that mean we won't see a blip probably at some point in September? I think we will. I think we will because not 100% of the population is not vaccinated. I also don't think we'll see the huge spike we saw in Alabama and Mississippi and Florida, but we will definitely see a blip, which will be partly catalyzed by the whole back to school situation.
Well, talk to me about that because, yes, there are reports out today nationally that caseloads are 3 times where we were last Labor Day. The difference, of course, being we have vaccinations now.
Unfortunately, the situation with schools, as I see it, is that we have individuals who are working in those buildings who are not vaccinated. And we have case after case throughout the United States of seeing children being infected by teachers who are not vaccinated. The Delta variant does not seem, and all the variants so far do not seem to be creating death in children. Right. And that is a blessing, but it's just a matter of time before there's one that does. So my hope is that in New Jersey, the majority of our educators will be vaccinated or they will wear a mask and we will not see this phenomenon. But I would be prepared. I would think we all should be prepared that we're going to see an increase in child infection over the course of the next month.
So let me just ask you, because I think that there may be some sense of, and I'm saying false hope, but maybe it's not false hope, that at some point this Delta variant will make its way through the population, will max out, so to speak. Is that realistic?
Yeah, probability models would argue that, right? That at some point it will have infected, and at some point there's nobody else to infect, right? But the problem is there always is going to be somebody to infect, right? It's just that the number of people so you have 2 groups. You have the people who are unvaccinated who can get infected. There are people who are vaccinated who can get infected but not get sick, right? So as the number of vaccinated people increases, right, the spread of the Delta variant decreases, right? So it can still make inroads, but not at the rate that is made over the course of the last 2 months. So if you can imagine, I don't know, like some old 1970s game, like Space Invaders or something like that, with a little rocket shooting, right? There's less things to shoot. There's less asteroids to shoot, right? Because more people are vaccinated. That's how I think about it, right? It's going to be harder for the Delta variant to continue to spread.
Great visual. Excellent point. Dr. Perry Halkitis, good to talk with you. Thank you so much.
My pleasure.